What if your game isn't changing because of your swing? What if your body's changing and nobody ever told you how that would show up on a golf course? That's the conversation that's been missing, and it's costing people years of good golf. On today's round, we're talking about why golf is the perfect metaphor for life, how you're not too old, and how it's not too late. You're listening to Playing for Life. I'm Dr. Amy Garza, a physician, aspiring competitive golfer, and someone who's convinced that in midlife and beyond, what wins isn't a better swing, it's a better physiology. Each week, we're connecting the dots between your health, your hormones, and your golf game. The conversation your doctor and your swing coach should be having. Glad you're here. Let's tee it up. So, I want to spend this first episode doing something a little different than what you might expect from a health and medicine podcast. I'm not going to open with a study. I'm not going to give you a list of things you should be doing. What I want to do is just talk to you because I think you showed up here for a reason, and I want to make sure you know exactly what you walked into. So, let's start there. I'm Dr. Amy Garza, and I've been practicing medicine for over 25 years. I'm board certified in anesthesia, and while I started my career in the operating room, I spent most of my time as a doctor learning things we never really were taught in medical school. The most fun realization for me has been how my anesthesia background, when coupled with additional certifications in age management, hormone and peptide therapy, and metabolic health, has given me a really unique approach to midlife. For over a decade, I've been managing hormones for men and women both, day in and day out. At AgeWell, my clinic in Texas, I work specifically with people in their 40s, 50s, and 60s who are trying to understand why they no longer feel like themselves, what is happening in their bodies, and what they can do about it. One of the coolest things that's come from my clinical experience is seeing in real life, in real patients, what actually works. I tell you that because I want you to be able to trust that what I share on the show has real clinical grounding. There's a lot of noise out there, a lot of conflicting information, and a lot of things that sound scientific but aren't. There's a lot of advice that's technically true but completely useless in real world practice. My job here and in my clinic is to cut through all that noise, to take the complicated stuff and translate into something you can actually use. And then there's this other part of me I think you'll find interesting. I'm 52, I played collegiate golf, I walked away for about 25 years because medical school, residency, raising 4 kids, and building a practice will do that. And I found my way back to the game and fell completely in love with it. I have competitive goals, and with the single digit handicap, I'm working towards some big things I wouldn't accomplish before I'm 60. Here's why that matters. I need to age well to play this game at the level I want to play it. It's not a nice sentiment, it's a real, specific, personal motivation that drives my own health decisions every single day. Everything I talk about on this show, I'm doing myself in real time. I'm not up here with all the answers looking down, just a few steps ahead on a path I'm still walking. And I want to bring you along. So let me ask you something. Are you feeling less like yourself sometimes these days? Have you noticed your game changing? And I don't mean your swing. I mean, when did you start noticing things that didn't used to happen? Things like the distance that quietly, gradually isn't there anymore. Or the way the back nine feels categorically different than the front nine, and not just because your legs are tired. Maybe it's the moment you're standing over a chip shot you've hit 1,000 times, and suddenly, inexplicably, you're not sure if you're going to be able to pull it off. And the worst part, you can't quite explain why. Maybe you've started blaming your equipment and gone down the rabbit hole of swing instruction, changed your grip, your stance, your takeaway, all of it. Maybe you've just quietly, privately started accepting that this is what getting older looks like on the golf course. That you're on the back nine of your golf game and there's not a lot you can do about it. That idea that you have to accept what we've been taught is just getting older, I want to push back on that hard. You see, if there's one thing that over a decade in age management medicine has taught me, is there's a difference between expecting changes as you get older and accepting them. What if your game isn't changing because of your swing? What if your body's changing and nobody ever told you how that would show up on a golf course? That's the conversation that's been missing, and it's costing people years of good golf. The distance that's gone, that may not be a mechanics problem. What if it's a hormonal and metabolic story with a name and a physiology and, frankly, options? options most people have never been offered. The back nine fatigue that hits like a wall somewhere around the 14th hole, it's not necessarily fitness. We have patients who are generally fit. They work out consistently, they're not overweight, they walk 18 holes no problem. They still fall apart somewhere late in the round. And the confidence issue, the thing where your mental game that used to be really sharp suddenly is unreliable and you're not sure why or when it shifted. There's a physiological explanation for that, and it's not a character flaw and it's not permanent. Your sex hormones, your metabolism, your brain health, and even your gut health are all doing something specific that we can talk about and actually address. Your game didn't change because you got worse at golf, your body changed, and nobody's connecting the dots for you. And for those of you who aren't lifelong golfers who feel like you've lost something, this is for you too. Maybe you're someone who's always wanted to play or who's just getting started. Someone whose kids or grandkids play and you want in on that world. But somewhere in the back of your mind, you're wondering if you're too old to actually get good at this. I'm here to tell you, you're not too old and it's not too late. Golf might be the single best sport to pick up in midlife. And I mean that clinically, like not just as a pep talk. The cognitive load of the game, course management, shot selection, reading conditions, and staying mentally present for 4 hours is genuinely protective for your brain. The walking, the rotation, the balance, even the social component. These hit all the things that we talk about with healthy aging. I mean, if golf didn't exist, someone would probably be trying to invent something as a longevity intervention just like it. And unlike most athletic endeavors, your ability to improve at golf, it's not tightly coupled to raw physical power. Skill, strategy, and course management can make up an enormous amount of ground. I mean, I've seen patients in their 60s become competitive players starting from almost nothing. So if you're new to this or newly serious about it, this show is for you. The biology we talk about applies just as much to building a game as it does to protecting one. And here's why I keep coming back to golf as the lens for everything I want to talk about on this show. Golf is the most honest game in the world. You can't fake your way through 18 holes in midlife like you can in your younger years. You can fake a lot of things in life: a hard conversation, a bad day at work, how fine you are when you're not fine at all. And golf finds it all, especially as you get older. It finds the hip tightness you've been ignoring for months. It finds the fatigue you've been powering through on willpower. It finds the anxiety that's been quietly living in your chest. And it puts it right there in front of you on a tee box with people watching. Aging does the same thing. The changes come slowly at first. Each one is subtle enough that you explain it away. Sleep got a little worse, but work's been stressful. Recovery takes longer. Well, you're not 30 anymore, right? Mood's a little harder to manage, but who can blame you given everything going on? Maybe even carrying a few extra pounds that didn't used to be there and they're not budging no matter what you try. Metabolism slows down. It's just life. And then one day you're on the course and you reach for something that used to be there: a physical capacity, a mental sharpness, a confidence you didn't even know you had until you didn't have it anymore. It's just not there. That moment, it's not a golf problem, it's a biology problem. And the good news, biology problems have answers. This show exists because the conversation between medicine and golf has not been happening. No one's connecting the dots between your motivational drive, your metabolic drive, your sex drive, and your golf drive. And they should be. So here's what I want this show to be. Every episode, we're going to take something happening in your body: hormones, metabolism, nervous system, sleep, inflammation, mindset, even your sex life. All the things that affect every person moving through midlife. And we'll connect them directly back to your game. Not because golf is the only thing that matters, but because it's the signal that makes all of this obvious. It's the frame that makes it concrete. It gives abstract biology a place to live in your real life. My goal is to give you frameworks, ways of thinking about your body that you can actually apply to your own decisions. Because the problem most people have isn't a lack of information, it's that there's too much information, a lot of it contradicting itself, and no good way to evaluate what's actually worth paying attention to. What I do in my clinic every day. I help people cut through the noise, and that's what I want to do here. I'll tell you when the science is solid. I'll tell you when we're making educated calls with imperfect data, which honestly is a lot of medicine. And I'll tell you the difference between the two. You deserve that honesty more than you deserve false hope from me. You see, you're the hero of this story. Your body, your game, your goals, your life. It's what we're working toward. I'm simply the guide. I have a map and I want to share it with you. But you're the one doing the work, making the choices, showing up to the course. My job is to make sure you have better information than most people get, explained in a way that actually makes sense. Over the next several episodes, we're going to go deep on the 3 things I see change most for golfers as they move through midlife. These aren't arbitrary. They're the things patients bring to me constantly, and they're the things I track in myself. We'll start with sex hormones, not because they're the most important thing, but because it's usually the first place where the biology makes itself known on the scorecard. We're going to talk about what's actually happening in your motivation, energy levels, focus, muscles, and more. What testosterone does for both men and women. I cannot tell you how often this conversation is missing for you and how much it matters. And what you can realistically do about these hormonal shifts as you age. Not everything's recoverable. Some things are, but we're going to be honest about which is which. Then we'll get into the back nine problem, which is one of my favorite topics because the solution is so much more interesting than people expect. And we'll talk about the confidence piece, the mental game shift, because there's a physiological story there too that almost nobody is telling. Your game has changed, and you've probably blamed yourself or your swing or just the passage of time. But the changes in your game are not random. They're not inevitable in the way you've been taught. Your body is going through something real and specific. This is the part I need you to hear. Something that can be understood, addressed, and in many cases, significantly improved. The long game isn't over, not even close. But you need better information than you've been given and someone willing to actually explain it. That's what I'm here for, and I'm really glad you're here. And one last thing. If something in today's episode hits a sweet spot, do me a favor. Follow the show so the next one finds you and share this episode with a golfer who needs to hear it. And I want to hear from you. Drop a comment and tell me what landed and what you want us to dig into on a future round. Your questions shape where this show goes next. Until the next round, this is Playing for Life.